Okay, so hi everyone, I'm doing Down syndrome as my genetic disorder project. To start off, what is Down syndrome? So Down syndrome is a genetic disorder which happens in newly born babies. So basically, they get an extra copy of their chromosome 21. It can cause Down syndrome can cause them to grow and develop differently than people without Down syndrome. They take more time to develop, like they take more time to walk. They take more time to speak properly, to say the words than people without Down syndrome. So this was founded by Dr. John Langdon in 1866 by French physician Germain Lejeune. He he found the cause and discovered more depth of it in 1959. So let's go right into symptoms and affected body systems. So as you see in the first slide, the picture of of a girl with Down syndrome, she has a that's a person with Down syndrome. So basically, people with Down syndrome have small physical size, weak tone, and flattened faces. They have problems with their delay in speech, language development, attention problems, unnecessary tantrums, and sleeping problems. Affected body systems can be brain, immune system, respiratory system, and nervous system. So types of people and how you get. So types of people. So we can't really say that these type of people usually get it, but in statistics, more boys get than girls, and it's more common in Hispanic and American Indians. But that doesn't mean that only they get it. So usually, a lot of statistics shows that women who have who are pregnant when they're 35 or older usually get a son or daughter Down syndrome. So expectancy has increased from 25 in the past to 60 in the present time. This changed from modern medications and treatments and medicines and the way of making a person with Down syndrome adapt to more of our lives. But it's true that a person with Down syndrome, as they get older, they get more and more diseases, which will stop them from living a long, full, healthy life. But how you get it? Down syndrome is not really gotten from past like for parents. It's not inherited, and but it's happened, and it's not either dominant, recessive, autosomal, or X-linked, and caused by non-destructions. So it's caused by abnormal actions during gamete formation like in meiosis or cell division or DNA replication. Any problems caused, then there will be a chance of you getting Down syndrome. So affected genes and the causes. So as we know that Down syndrome affects the chromosome 21. Okay, so that means it affects all the genes and the proteins that code for the genes in that chromosome. So usually with a person with a baby with Down syndrome, their parents either have 24 X cells or 24 sperm cells, which instead of 23, which then cause when they fuse together, which cause a baby cell that has 47 chromosomes. The extra chromosome will go into the 21st chromosome. And this will cause a mutation, which can cause a gene dosage imbalance in the baby's body. And in transgression, another type of Down syndrome can cause other chromosomes to get the extra pair, or it can cause something like this in this picture. Okay, so treatments and diagnosis. The diagnosis can be screening test, which checks the babies during before the baby is delivered, and amniocentesis test checks how many chromosomes the baby has. So during the first or second trimester, the doctors can take a sample of the amniotic fluid that surrounds the baby and take it from the mother's uterus to check how many chromosomes it has. This can help to see if the baby has more chromosomes than it should have. Chronic villus sampling is also a different test to see how many crumbs the baby has. But instead of taking it from the amniotic fluid, it takes cells from the placenta to see how many chromosomes the baby has. So in this matter, if a baby does have a more chromosomes than it should have, then it should be Down syndrome. And at the end, you can decide if you want to do genetic counseling or not. So genetic counseling happens before and after the baby's born. Genetic counseling helps the baby for communication process, which helps the baby to face real life problems in the real world as they grow up. This also helps parents to teach and teach their son or daughter with Down syndrome. So there's not really treatments. You can't really have like a drug or a cure for Down syndrome, but there's definitely therapies. It's like something like physical therapy, speech and language therapy, occupation therapy, emotional behavior therapy. Can also increase increase the baby ability to live in the real world. By using all this therapy, it can cause them to become a person, maybe become closer to be a person without Down syndrome. But there's some cases where they use psychoactive drugs to increase the brain activity because patients with Down syndrome has a less cognitive ability to understand things, to keep focus on one thing, to answer quickly like that. But it's not always it's not always used. Mostly therapy. Future treatments. So future treatments can be like um future treatments can be like to make a drug that boosts the chemical measure morphine to increase a brain's cognitive abilities. So cognitive abilities, like I said before, is ability that persons have to answer problems, to pay attention, to control your body in the way you want, to grow and develop quicker, to understand things, all of this. And morphines or drugs which will boost that, but this is not tested in patients with Down syndrome. It's only tested in mice where they have an extra pair of chromosome in their 16th chromosome. And this is from MIT review. And they're still testing it, and I hope in the future they can make this effective more. Things that I learned about Down syndrome is that Down syndrome causes a person to have extra pair of chromosome. There are three types of Down syndrome: trisomy 21, transcobalación, and mosaicism. I found out it affects the brain and causes them not to active, same as a child without Down syndrome. And I didn't know that it was found in 1860. So that's all. The rest of this will be out there. Thank you.